and welcome to today's roundtable discussion, Rethinking Healthcare Benefits, what employees need and what employees want. I'm Matt Edwards, I'm the Head of Insurance Propositions here at Westfield Health, and I'm joined by 4 experts on this panel, and I'll kindly ask them to introduce themselves now. Starting with yourself, Mark.
Hello, I'm Mark Hampson. I'm the Managing Director for the insurance business at Westfield.
Hi, I'm Louise O'Keehan. I am the National Sales Manager for Westfield Health.
Hi, I'm Fran Cowell, Chief Operations Officer for Learners Trust and a client of Westfield Health.
Chris Wormsley, National Sales Manager, focused on our intermediary distribution.
Okay, so now to start the discussion, Westfield Health research shows that employees with high wellbeing report half the levels of absence and 2/3 less presenteeism compared to those with low wellbeing. So the first question is, against that backdrop, how would you describe the UK health benefits market right now? What trends are you seeing? Would you like to take that first, Mark?
Yeah, I think the first point is the UK is probably at an inflection point. And by that, I'm suggesting that people are now looking for digital ecosystems, employers are looking for more value, and employees are looking for more access.
Yeah, I think you're right, Mark. I think at the minute the employee benefits sector is really growing, specifically around the cash plan market as well, where the focus is really driven by value compared to price.
I think the other key point is historically this market has been very much about reimbursement for trips to the dentist, to the optician, but we're now moving very much to clinical-based services like access to GP, employee assistance program.
And supporting the tailoring of those products as well, making sure that what we deliver in benefits really hits the sweet spots for the employers.
Yeah, I think that's right. And also the big focus now is very much on prevention and keeping employees in the workplace for longer.
For me, it's all about the consultative approach. Having that discussion with the client around what their needs are, what the key aspects that are causing issues within the workplace, whether that's mental health, whether that's musculoskeletal in the workplace, and really approaching it with an ability to look after their needs. It is a very diverse workforce that some employers have to deal with, so encapsulating a bespoke product within there that covers all of their needs and looks after every part of their workforce from 18 right through till 60 plus.
Okay. And do you find the same trends, Chris, in the intermediary space?
Yeah, I think with our intermediary partners and broker spaces, they're always looking to deliver tailored demands to their clients. So looking at how they can understand their clients' needs, where their pain points are and what they really want to gain from the product is where the consultants can really analyse that and help them bespoke the level of cover.
What challenges are companies facing with providing employee benefits at the moment?
For me, what I'm seeing is budgets are tight. Yeah. And this year, definitely with the rise in national insurance contributions. So I think that is one of the key. They want to keep everything as simple as possible to ensure that they cover the whole workplace. So they're looking at the different ages within the workplace, but also the different benefits that would be niche to the different age sector.
It's making sure the planning is bespoke, because we're never going to meet everybody's needs, but it's getting them best for the majority.
I think the mental health agenda is really changing and growing as well. I think it's important that we extend our offering to a wider solution into neurodiversity requirements, cancer supports as well, that impacts people's mental health hugely. So how we can keep broadening our approach will only support you as an organisation and your people in return.
Would you agree with that, Fran? Is under neurodiversity, ADHD, anxiety, autism are very common trends that we're hearing in the education space? Is that a trend that you're seeing in your environment as well?
Yeah, absolutely. Yeah, we've seen an increase in that, especially where we've had people signed off work, and some of the reasons are now around anxiety and depression and stress. And actually, when you unpin some of that, it's actually some of the neurodiverse things that we need to look at and how we support that.
Do you think that having a support there would help your organisation, so they'll be able to call up and find out different aspects that could help and support around, whether it's ADHD, whether it's around autism, etc.? Would that be helpful within your organisation?
Yeah, absolutely. And I think it's just making sure they're aware of that, because I think that is the biggest thing. We can offer a service out there, but if they don't know what they can ring for, I think that's probably where people won't ring up. I think we need it to be quite a clear list of what they can ring up and ensure it's confidential and things like that.
So key for that digitalisation again, so having basically a portal where you can access, they can have a look at everything, they can see where everything is and what benefits that they have is key really for your organisation.
Yeah, absolutely. Yeah.
So on the topic there of data-led insights, what does the clients of Westfield need to see?
So us as an employer, we want to see the usage of the cash plan and also the employer assistance plan. We have to show value for money with public spending, and we don't always mean that as the cheapest company. We want the most bespoke service to our users that can be tailored year on year depending on the usage. We also want the usage data to be able to monitor the uptake and then be able to bespoke our plan.
And I guess we want to make it as easy as possible for you to access that information.
Yeah.
So it's at the fingertips for you to make those decisions in a timely manner.
Yeah, and we need that information at all times because we can then report on it to our trustees and our boards at any point rather than having to request it from Westfield Health.
It's definitely a trend we're seeing in the broker space as well, of instant access to MI, wanting to have that information at their fingertips to use.
I think driven MI ensures you're staying front of the key curve within an employee-focused environment. So you're knowing that, okay, all of a sudden the employee assistance program stats have risen. What's the reason around that? So you have the requirements and the data to drive that forward, and you're looking ahead of what you can do next.
Yeah, it's to be able to provide the benefits for the employees that they actually are going to use, and having Westfield rewards and gym discounts, they're things that people can benefit on a day-to-day basis, even if they don't need physio appointments or medical treatment.
Really interesting to hear Fran's points from a client perspective, but how do you interpret that in meeting a client's needs?
I think Fran makes a great point of moving from a transactional relationship into a much more personalised arrangement.
I think that's key. One of the key things when we're working with yourself is having that bespoke conversation each year around what the trends are we're seeing, and then putting a plan in place that suits your employees' needs, and also being on that forefront so that we're ahead of the game, so that you know actually this is rising within your workforce, or we need to look at this, and we're having those meaningful conversations. Would you agree on that?
Yeah, absolutely, and that's how we can then tailor our marketing out to our staff and advertising services. We've tried emailing staff, but when we've got over 650 employees, emails can soon get deleted or missed. So we're now looking at having notice boards and internal intranet to kind of share this information, but we're also looking how we can bespoke some of the messaging, so like flu jab messaging in October and gym memberships in January, where there is a trend that them things are going to be uptaken, to try and promote that.
So bespoke work's key for you, having that tailored approach and a personalised approach.
Yeah, absolutely, yeah.
How are organisation and employee expectations of benefits changing, and what impact is it having?
From the businesses I've spoken to in the last year, there's definitely a swing from treating illness type solutions to move into a much more preventative agenda. And I think some of the vehicles that are out there around cash plans in particular help people access those kinds of benefits. Fran's already touched on the needs for digitisation and admin sort of solutions that help businesses do it in a more cost-effective way. And I think the other key thing now is the fact that people are looking for new services for new conditions that we've touched on earlier.
I think, Fran, what you were saying earlier around having that ability to have everything within the workplace for all of your staff, how do you get that across within a diverse workplace?
But I think it's now looking at actually how do we get what they actually want? Is there anything that we're missing? We have looked at surveys, but I think unless you get a good percentage of uptake, some of that data still will be hard to actually action. So I think it's one of our challenges at the moment to try and get that feedback from our own employees of what they want.
I think the other point around flexibility now, so many years ago you could only access services between 9 and 5. I think more and more people are looking for access early in the morning, in the evening, whether it's physios, whether it's doctors, whether it's sort of dentists. So I think that's a trend that's only likely to grow.
Yeah, and we've seen that in our organisation, especially with the digital GP, that you can get an appointment at 11 p.m. at night, and actually that sometimes works for our staff rather than it being in the middle of the day. You're not having to ring up at 8 a.m. for your own doctors because you've got it on hand. And it is the flexibility of the plan where we've currently purchased counselling sessions. Yeah. If an employee needs more, we can add to that and keep making sure that employee gets the support. It's not like a fixed plan, which is really good.
And I think the other thing, we touched on the sort of cost of living and the impact on employers. I think the cost of living for employees is just an issue that's been around for the last couple of years. I think the cost of treatment has only gone up. So I think cash plans still are very relevant to those audiences and for what people use them for.
Chris, how do you see them working in a more remote client where the workforce may be spread around the UK, or they just may work from home?
Yeah, I think there's a real shift to a digital first solution.
Yeah.
I think both at the employee level of accessing the treatment, accessing the services, but also from the administration of the product as well, making it as easy as possible for companies to make ons and offs in a seamless transaction, but also have that MI capability to give that evidence that's required.
Fran, are you seeing anything from your employees that they're asking for something different within the marketplace at the moment, or are they happy with the benefits that you're providing?
They're happy with the benefits that we're providing at the moment. I think we need to continue to monitor that on an annual basis. I think it soon can give us a bad reputation if the employee doesn't see where the value for money is, that we're spending like public money on. So I think it's just one of the things that we're constantly evaluating and trying to get the feedback from our employees on.
It sounds like the need is to support the end employee, but there's also perhaps a need for the employer to receive some support as well. They may need some guidance or advice on how to tackle a certain conversation that they're not familiar with.
I think we're seeing that a lot on the workforce at the minute. We do a lot of wellbeing support around neurodiversity, around sleep, around mental health, etc. But it's having that support within cash plans and to help and support HR leaders, and also to support the workplace and the employee around whether it's if someone's suffering from a cancer or if someone's suffering and they need support around neurodiversity. It's really key to help the HR manager because we are working in a very diverse workforce, so it is important.
I think that's an expectation now that we need to deliver and we need to continue to improve on, that all our solutions, as detailed as they are with the benefits it provides, they're very easy to understand, they're very easy to access, they're very easy to share around the organisations, and that really comes to a digital first approach on all our customer channels from broker, corporate and consumer.
I think it's having that digital information at all times so we can access it whenever, because we do quite a lot of flexible working, so to be able to access that information after business hours is really good, and to be able to do our own testing on the information or be able to pull reports as and when needed, I think is good.
So it sounds like your workforce is spread across multiple sites across a couple of different counties. It sounds like you won't have much time on your hands at the moment. So what would be useful for you to be able to claim some time back?
Yeah, so everyone's based on site, and our schools are based across Derby, Chesterfield and Rotherham, so it's quite a widespread. We've recently found out as well, like more information about our own workforce, and found out that our average age is 45, and actually we've got a primarily women, female workforce in there, so it's now looking at what benefits can help them, and actually are they different to what we're currently offering.
You see it as a key retention and attraction strategy within your workplace?
Yeah, absolutely. So one of the newest things we've done is kind of advertise this as part of our recruitment strategy, especially for the roles that we are struggling to recruit for. And it's kind of just advertising that as a benefit on recruitment, and making sure when they're inducted they're given all the access and all the information that they need to benefit from it. It's also building this into our HR strategy and our recruitment strategy to try and get people in and kind of see the benefits that we can offer them. We have had one case where an employee attended a physio appointment via Westfield Health cash plan and actually got back to work sooner than the NHS referral for physio, and that's a great experience and the types of things that we want to share with all our staff.
So we do see that prevention is key. It's key for the workplace, it's key for the employers, and it's also key for the employees so that we can keep them at work.
I think just to bring that to life as well, one of our employees is currently accessing the counselling sessions, and actually where they've hit the limit of what we currently purchase, we've actually been able to extend that to ensure the employee gets the support they need and hopefully returns to the workplace sooner, rather than send them to like NHS and having to go on a waiting list. So it's really good proactive support that we can actually offer to our employees.
So it's interesting to hear Fran's approach to this and the challenges that you have based on the current, the size that you currently are. Is that the same across the different portfolios of clients from large to small?
Yeah, definitely. HR managers, whether in a small organisation, could be doing a lot of different roles. So having that ease of administration to administer a Westfield plan is key, and it's even more so in a larger organisation. Fran's running a school of over 650 employees, so it's really key that we listen to what our employers want and have that in place for the future.
Yeah, I'd agree that, you talk about different size of populations within the workforce, but there's multiple benefits in there, specifically the broker space, where they're advising on different benefits and different solutions. Having that in an easy access under one roof portal is really key.
So, and what sort of things are those clients asking for, Chris?
I think in the broker space, there's a number of key kind of channels that they want delivering, from ease of sales, so actually getting access to quick quotes and being able to see what the benefits can provide, all the way to digitalisation, the application process. So contracting would become so much easier, less handoffs, quicker turnaround times, seamless journeys for both the broker and the corporate at the end of that journey, but then into the management of that product as well, being able to make the changes that they require, adding new members, but also seeing the MI, which we talked about earlier, at a click of a button, and have that access 24/7 really makes it easier for them to provide evidence to their stakeholders across the wider population.
It's been a really interesting discussion, really enjoyed it, and if I could summarise the key themes that I've been hearing really across the panel today is digitalisation and the changing needs, which has mean products need to be more personalised than ever before to meet a diverse range of client demand and employee need. The consultative approach, which the provider will need to provide to meet those ever-changing needs, as well as an evolving proposition, so that it's always on the forefront of what employees are requiring to be productive in the workplace. There's challenges that HR face, and they're evolving, as well as the expectations of both the employees and of the employers. And all of this really is pointing towards changing the market as technology comes through and digitalisation comes to the forefront of the market. So on that note, what do you see as being the biggest opportunity in employee benefits over the next 12, 24 months?
For me, it's really around personalisation and flexibility.
Yeah.
Having that a consultative approach with our client, listening to their needs and ensuring we have the flexibility to deal with all the life stages within an organisation. So we're looking after the whole of the workforce, not just like an off-the-shelf product that just fits one stage of the workforce. So we really need to be personalised, listening and consultative the whole way through when we're dealing with our clients.
And I think that's right. And I think to build that out based upon Fran's feedback and other clients' feedback is probably three parts to integration. People don't want it separate and all over the place. They want it all pulled together. So I think if you're looking at prevention, I think if you're looking at well-being, I think if you're looking at insurance, people want easy access to all things. I mean, Fran touched on the EAP service being slightly disconnected from the insurance. I think the insurers have got to get that together and make sure it's one solution for all.
Yeah, I'd agree. I think Fran's really detailed how difficult it is in your corporate space in making sure you're hitting the needs. And I think what we've got to do as an insurer and working with our broker partners is really listen and become a benefit specialist in certain areas and really tailor our delivery within the products that hits the sweet spots that's going to give the biggest return on investment. Doing that in a digital way that helps you and gives you time back and makes it easy to interact with, easy to understand our solutions, and give you the support that's needed in an ever-changing environment.
Okay, thank you. Real good summary. And if you could just give one piece of advice for employers when they're defining their strategies, what would it be?
I think for me, for all employers, I'd be thinking big, thinking strategic for the future. I think historically health propositions have been seen as a big cost or a cost to the business. I think this conversation alone has shown how important it is to employers for a whole host of reasons, including how you attract new employees, how you retain, but equally how do you maintain a healthy workforce. I think that's really important.
For me, it's definitely about focusing on flexibility and integration at that whole of workplace approach. So you're looking at the mental, the physical and the well-being of the organisation. But I'll come to the expert here on this, Fran. What do you feel is key?
I think the key for us is the flexibility of the plan, having it at the right price with the data usage to be able to back that up and kind of evidence that it's being used, and also the great customer service and kind of making you feel part of a company rather than just buying something.
So it sounds like providing the right wellbeing solution to a workforce has gone from a nice to have to an essential requirement to keep employees engaged.
I think Fran also touches on a key point, is that in the world that we live in now, service is still a really key driver. You expect a high level of service and engagement from your provider, and I think that will remain as we go forward.
I really enjoyed the discussion this morning. It's been really useful and insightful for me. Thank you for all contributing as well as you have.
Thank
you.
you.
Thank you.